Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, today we are going to learn about the oropharynx. Okay, but before that, I just want to show you what is pharynx. Okay, pharynx is a fibromuscular tube. Okay, extending from the base of the skull here. So meaning here until the lower border of the cricoid cartilage. So this is the cricoid cartilage and this is the lower border of cricoid cartilage until here. Okay, and if you want to compare it with the vertebra, okay, it's from the base of the skull, and then this is the C1 vertebra, C2, C3, C4, C5 and C6 vertebra. So meaning it begins from the base of the skull until the lower border of the C6 vertebra. Don't be confused, this is C2. C1 is very small. Later you will learn why C1 is like this. It's an atypical vertebra with no vertebral body. Okay, so pharynx can be divided into three parts. Okay, this one, the upper part here, the most superior part, which is located posterior to the nasal cavity, is the nasopharynx. Okay, the one that is located posterior to the oral cavity is the oropharynx, and the one that is located posterior to the larynx is the laryngopharynx. Okay, laryngopharynx. And what is the demarcation? So this is the nasopharyngeal isthmus. The opening here is called the nasopharyngeal isthmus. This is where nasopharynx is connected with the oropharynx. And oropharynx is connected with the laryngopharynx. No specific demarcation, but it's at the tip of the epiglottis. So today I'm going to concentrate only for the oropharynx. So again, the oropharynx is part of pharynx that is located posterior to the oral cavity, and it extends from the soft palate here and the nasopharyngeal isthmus to the upper border, tip. This is the tip of the epiglottis. So it extends from here to here. Alright, so the connection of oropharynx, superiorly it is connected with the nasopharynx via nasopharyngeal isthmus. Okay, anteriorly by oral cavity via oropharyngeal isthmus, or also known as isthmus of Forsyth, and inferiorly there is no clear demarcation, which is at the tip of the epiglottis. Okay, that is the connections of the oropharynx. Okay, and what forms the superior wall of the oropharynx? Okay, what forms the superior wall of the oropharynx? It is the soft palate and the ovula. Okay, what forms the anterior wall of the oropharynx? It is here, the lingual tonsil. And there is also a space here between the posterior part of the tongue with the epiglottis, and this space is known as valleculae. Okay, and apart from that, the anterior wall is also formed by the tip of the epiglottis. So that is the anterior wall of oropharynx. And the lateral wall of oropharynx, you can see here, this is the tonsil, the palatine tonsil. Okay, palatine tonsil. It is located in the tonsilla fossa. By right, you can see, but you cannot see in this model, not that clear. But by right, you can see two folds anterior to the palatine tonsil, which is the palatopharyngeal fold, and the posterior to it is the the anterior fold is the palatoglossal fold, and posterior to it is the palatopharyngeal fold or arch, palatoglossal arch or fold, and palatopharyngeal arch, the posterior part. Okay, but it is not clear here. And other tonsils in the pharynx include this one here, which is at the nasopharynx. This is called the pharyngeal tonsil. The one that is located at the auditory tube, at the tubal elevation of the auditory tube, this is the tubal tonsil. This is the palatine tonsil, and this is the lingual tonsil. So if you have in the other parts of the other half of the head, so you can connect all these 4 tonsils and it will form a circle, and that is what we call the Valdeye's ring. Valdeye's ring. So I think that's all that we can discuss from this model. Not so much on the muscles of the pharynx. I think I will just upload the diagrams in the practical questions. That's all for now. Thank you.